Pharmacology. Basic terms. In pharmacology, there are several basic terms that are commonly used to describe the study of drugs and their effects on the body. These include pharmacokinetics, the study of how drugs are absorbed, distributed, metabolized, and eliminated by the body. Pharmacodynamics, the study of how drugs interact with biological systems to produce their therapeutic effects. Dose-response relationship, the relationship between the dose of a drug and the magnitude of its effect. Therapeutic index, a measure of the relative safety of a drug, calculated as the ratio of the dose that produces a therapeutic effect to the dose that produces toxicity. Adverse drug reactions (ADRs), undesirable or harmful effects of a drug that occur at doses normally used for therapeutic purposes. Drug interactions, the effect of one drug on the action of another. Drug tolerance, the diminishing effect of a drug with continued use. Drug dependence, a state in which an individual requires a drug to function normally. Drug addiction, a chronic brain disease that causes a person to compulsively seek out and use a substance despite the harm it causes. Others. Terms of pharmacology. Here are some additional terms commonly used in pharmacology. Drug target, the specific biological structure or process that a drug interacts with to produce its effects. Agonist, a drug that binds to a receptor and activates it, mimicking the action of the endogenous ligand. Antagonist, a drug that binds to a receptor but does not activate it, preventing the action of agonists or endogenous ligands. Synergy, the phenomenon in which the combined effect of two or more drugs is greater than the sum of their individual effects. Potency, the concentration or amount of a drug required to produce a specific effect. Efficacy, the ability of a drug to produce a maximal desired effect. Half-life, the time it takes for half of the drug to be eliminated from the body. Bioavailability, the extent to which a drug reaches its site of action after administration. First-pass effect, the metabolism of a drug that occurs in the liver before it reaches the systemic circulation. Prodrug, an inactive compound that is converted into an active drug after administration. Pharmacogenetics, the study of how genetics influences an individual's response to drugs. Personalized medicine, tailoring the treatment of a disease based on an individual's genetic makeup, including the use of pharmacogenetics. In pharmacokinetics, Cmax and Tmax are two commonly used parameters to describe the concentration and time course of drugs in the body. Cmax, the maximum concentration of a drug in the bloodstream after it has been administered. This can be used to determine the optimal dosing schedule. Tmax, the time it takes for the drug to reach its maximum concentration in the bloodstream. This can be used to determine the rate of drug absorption. AUC, area under the curve, the total amount of drug in the body over time, calculated by the area under the curve of the drug concentration time plot. It is often used to describe the overall exposure of the drug. T1/2, half-life, the time it takes for the drug concentration to decrease by half. It is used to determine the rate of drug elimination. VD, volume of distribution, a theoretical volume that describes the distribution of a drug in the body. It is used to determine the extent of drug distribution. CL, clearance, the volume of blood from which the drug is eliminated per unit of time. It can be used to determine the rate of drug elimination and the potential for drug interactions. Bioavailability, the proportion of the drug that reaches the systemic circulation after administration. F. Bioavailability fraction, the proportion of an administered dose of unchanged drug that reaches the systemic circulation. It can be used to determine the relative efficiency of different routes of administration. These parameters are important to understand the behavior and fate of drugs in the body and in designing appropriate dosing regimen and predicting the outcome of drug therapy.